And welcome to Nutrition Science Bites Series 3. Today my special guest is Professor Leonie Heilbronn. And Leonie has a couple of hats that she's wearing. She is a clinical research scientist within the Adelaide Medical School at the University of Adelaide. And she also works at SHAMRI. And I actually don't even know what that stands for, but it's SAHMRI. So I'm going to get Leonie to tell us what that stands for, but I just want you to know that she actually leads the obesity and metabolism research lab there, and she's working on both nutrition and behavioural strategies to really optimise people's metabolic and circadian health. So that's another really fancy word as well. So welcome, Leonie.
Hi, Claire. Thanks for having me.
Yeah, so first up, you have to tell us what SHAMRI is, and then
Okay,
and then can you also tell us what does circadian mean? Because that's a very, very fancy word.
sure. So, SAMRI is the South Australian Health and Medical Research Institute. It's the flagship institute in South Australia, and it combines all three universities that we have here in South Australia,
Oh,
as well as the standalone institute of SAMRI.
so super, super fancy. And the circadian bit of your
Circadian.
research, what does that mean?
Correct. Okay, so when I say circadian, I mean the natural rhythms that occur over 24 hours. So, like the day light cycle, the sleep wake cycle, and it's kind of that pattern that we have over 24 hours, and it's controlled by lots of different things. But
Yep.
what scientists have kind of discovered in the last few years is that food intake can also control our circadian rhythms.
Right. Okay. Well, we might come back and touch on that, or we might even come back and do another whole podcast on that. So today's big focus is on fasting diets, and I wanted to talk to you about it, Leonie, because I know you're doing a lot of research on it, but I think people get really, really confused because it seems like over the years there's been a whole range of different fasting diets. So I thought no better than having you start off by telling us, like, what is a fasting diet anyway?
Yep. Okay. So a fasting diet is when it's specifically instructed not to eat for a period of time, and that period of time should be at least 14 hours in a day. There's some arguments that it should be that not eating period is 16 hours a day, but 14 hours is kind of where it's landed as classifying as a fasting diet. So if you haven't eaten for at least 14 hours in a period of a day, there's a fasting component to that, and
Right.
there's lots of different types of fasting diets
So
that
just a
exist
quick
now.
summary. You said 14 hours. So if I have dinner at 6 o'clock, if I don't eat breakfast till 8 o'clock, I'm doing a fasting diet.
That's a fasting diet. That's a yep, what we call
Okay.
it. That one's a time restricted eating diet. So that's one of them.
Woohoo, we've got one down pat, time
Yep.
restricted. We still
So
ate dinner a bit early and we
yep,
ate breakfast a bit
at
late.
about 8, a bit late.
So time restricted fasting diet.
Correct.
So that obviously then there's different types of fasting diets. So we've covered off time restricted,
Mhm.
and so what are the other types of fasting diets that people might have heard of or may have even tried?
Yep. So the one that's been around the longest is probably the intermittent fasting diet, and so that one is where it started off as alternate day fasting, so it was actually a 24-hour fast every
Whoa.
other day. So 24 hours, you couldn't eat from breakfast to breakfast or from dinner to dinner, and you had that full 24-hour fasting period. That quickly changed to allowing some calories during the fasting day. So that's more like we see as the 5-2 diet, where you can eat up to about 500 to 800 calories in your day. And I still talk calories. I'm sorry.
Well,
I learned calories.
I'm really good, Leonie, at converting. So 500, 800, you just multiply by four. So that's
For
like 2,000 to 3,200 kilojoules. But before we go on to the other diets, like you said that the alternate day fasting used to be absolutely zero food for 24 hours. I didn't realize that they started on that premise. And I was just thinking then, gee, I would be cranky if you said I couldn't eat a single thing for a
for
whole
24
24-hour
hours.
period. So when they were called the alternate day, they were mostly zero, and now intermittent, is that what you said? And that's
Yeah.
5-2?
Yeah, intermittent is 5-2 or 4-3. So some people do it as more 3 days a week of fasting and allowing that 500 to 800 calories per day. It's about 25% of what you would normally eat in a day,
Just
just about
25%. Yeah.
25%. And that's actually the criterion, fasting terminology, 25%. So it's 25% either 2 or 3 days per week. So it's more
Right.
like almost intermittent, very low calorie diet.
Yeah.
Is probably how it's more become. So every other day eating a very low calorie diet, or 3 days a week or 2 days a
So
week.
so there's alternate day, which was like zero food, fasting a whole 24 hours every other day. Presumably you still got to have water. Uh,
Yes.
the now intermittent, which is 5, 2, or 3, 4. Are there any, oh, time restricted?
Yep,
Any other
time restricted.
ones?
They're less studied. So there's obviously the religious fasting, so
Yeah.
Ramadan fasting, and that is fasting from sunrise to
Yeah.
sunset. So it's
Yeah.
almost like reverse time restricted eating. So you're eating actually when you would normally
During
not
the night.
be eating during the night. And I'm not sure whether we'll get on that later, but the health evidence for that is kind of mixed, I think. And the other one it's a newer one, and it is showing some benefits. It's called a fasting mimicking diet, and they go 5 days a week, 5 days a month, sorry, of very low calorie diet, but also protein restriction. So there's another one there.
Right. Wow.
That one's less kind of looked at. One group particular look at that in the world. And then there's, I guess, more prolonged fasting, which is, really not something I look at. So that's more than 48 hours of fasting. And that really is,
Yeah, that sounds like you're moving into like medical grade territory where
it's a
someone's going
medical,
to
yeah,
be in hospital and medically
yep,
supervised.
yep.
I do think it's interesting, Leonie, how the fasting have come up. And I remember when they first started, people going, "Oh no, fasting," and I was thinking, like I grew up Roman Catholic, and going, well, we kind of had to restrict a lot of stuff in Lent. No chocolate, give up a whole lot of things, and certain days of the Lenten period, like Good Friday, you really did eat sort of minimally. And I've worked with people from other cultures where they observe a fasting period or a fasting day, like separately from the Ramadan period. So it seems to me that fasting has kind of played a role in many cultures and religions forever, but it's more recent that it's moved into a strategy that's used specifically for weight reduction. Is it mostly for dropping body weight?
Dropping body weight, but also improving metabolic health. Yes, so probably over the last 15 years, I think only, has fasting really started to become studied in the scientific literature. But yeah, been around for millennia for many different religions.
Right. Okay. So now I need to know then, are they safe? You've described a big range of strategies with varying periods of time and varying amounts of what's still allowed. So are they safe? But first up, I just need to know, and I think I know the answer. Are you allowed to drink water still?
Yes,
Surely.
yes,
Yeah.
yes, yes. So it's food.
Whoa.
It's water fasting. Most of our studies we allow non-calorie beverages as well. So coffee, tea, black coffee and tea, or herbal drinks. If you wanted to have a mint tea or chamomile, all of those sorts of
Diet cola
things.
if you want.
We do diet cola, but we put a restriction on how much
Yeah.
generally is consumed. Say
Yeah. None
just
of
keep it
this
to
liters
600
and
mils.
liters.
Yeah, yeah. So yes, so we allow calorie free fluids and recommend calorie-free
Yeah.
fluids during
So
fasting
so
periods.
are they safe then? Like fluid is the most
Yep.
risky thing. So there's basically no fluid restriction unless that was, there was a medical reason for that.
Mm.
So are they safe in terms of other potential health effects? And um, does the literature tell you much information about like what would happen if it wasn't safe? So side effects or
Yep.
consequences of this approach if it goes wrong?
Yep. So when I'm saying yes, with the exception of prolonged fasting, so I'm not talking about the long
We're going to,
fast
you
that
know
should
what?
be
Why don't we
medically
just put that one
supervised.
in a box and
That's in a
go,
box.
we're not
Yes.
even talking about
Yeah.
that,
Great.
listeners. So that is not something that would be recommended as you're at home and you're following some sort of fasting strategy. Okay, so
So
the other approaches then, are they safe?
yes. So every study that's been done has not showed any difference in terms of serious adverse effects. So safety profiles are high. There's been no evidence that there's heart attacks or, negative
Yeah.
outcomes in terms of serious events. Now, there has been some studies, and one of ours showed as well that fasting diets were more likely to result in feelings of fatigue. So people can feel
Yeah.
more tired on a fasting diet.
Kind of makes sense, doesn't it? Because, 500 calories, maybe 2,000 kilojoules, 5 times 4. So that kind of makes sense. And you said 25% of your usual dietary pattern. So,
On that day.
yeah, I can kind of understand that. Like no fuel in the tank or lesser fuel. So I feel a bit tired. That makes sense.
Yep.
Any other ones?
So we also, and this was similar to calorie restriction, but there was more constipation compared to control. So again, something that you see potentially if you're dehydrated, and that can happen on fasting, which is why we really recommend to keep your fluids up. You
Yeah.
can become more feelings of constipation.
So for that
Become
one, Leonie, don't you think it kind of makes sense? Because if you're only eating 25% of the total amount of food,
Yep.
it's also going to be, there's actually less to need to be excreted.
To go,
Because,
yes.
yeah, so there's the two aspects. There's I need to go and I can't go. But then there's also, oh, my bowel function's going to change because I'm just not eating very much and there's not much activity down that end.
Yep, absolutely.
Okay.
And the other one that's come up sometimes is headaches. So ketones. So if you're fasting for a prolonged period of time, your blood ketone levels, and this is kind of like an alternative energy source that gets made in the liver, and ketone levels start to rise, and your brain needs glucose and kind of preserves that, and it makes ketones. And ketones can give you a bit of a headachy feeling. And so if you have really prolonged fasting, not prolonged, if you have above about 16 to 20 hours is when ketones start to come up in the blood, and then you
Yeah.
can start to get headaches.
Okay, so can we just drill down on this? Because I think ketones are super interesting and lots of people don't realize, but they know what ketones are because every time you clean your nails, take that old nail polish off, you're smelling acetone, which is one of the ketones. But this is quite amazing that your body can actually not only produce these ketones during fasting, but that your brain can use them. And that kind of makes sense. So, what are the ketones made out of, or why does your body start going, well, you're not going to feed me, I'm going to make ketones and make you have a headache?
Yeah, so ketones are interesting. There's some health benefits to ketones as well, potentially, which is one of the reasons
Mm,
why we kind of want them to come up, but not too high. And they're made from amino acids. So essentially, you have ketogenic amino acids that can turn into ketones in the liver to become an energy source for your body. And so you start to use fats and ketones when you don't have food availability. So you're really switching on your fat burning capacities when you're fasting. And that's one of the reasons why we think fasting diets may be sometimes better than calorie restriction diets, is that you're really activating the the fatty acid oxidation and the ketone pathways more than you would with a calorie restriction diet.
okay, so they're very, very fancy words. So I'm now going to ask you some more questions. So I'm fasting. I'm only having 25% of my usual energy intake. So let's say I normally eat 4 pieces of bread a day, and now I'm only having one per day. So it seems to me like if my body was a car, I'm making my body run on less fuel. And my body's going, well, I'll show you. I'm going to burn up other stuff in your body. If you're not going to give me the foods I prefer, does your body then selectively go, I'll find something? You've got some fat stores and I'm going to get them and make fatty acids and ketones. Is that kind of at a big picture level of what's happening, why we just start making ketones now and we weren't making them yesterday when you weren't fasting?
Yes, correct, essentially. So you can't rely on glucose, you have to rely on your fuel stores. So you have to rely on your fat cells to release those fats and burn them. And you also start to, when you're fasting long enough, bring up the ketones. Absolutely.
Yeah, isn't our body just so clever? Because, I think sometimes putting these things in the perspective of how long humans have been roaming around on this earth, they must have been doing intermittent fasting, not because were so fancy, but because they wanted to survive. Because, if you think about you roaming around, like, is there an ancient beast that I can catch and kill, or am I going to dig up the right roots? It must have been highly variable. So, is this really part of our very clever metabolism that we can adapt when we're not getting the right amount of food we need and just go, woohoo, I can use those fat stores, and you can keep hunting and gathering and survive another day?
Yes, exactly. So, evolutionary history, periods of fasting would have occurred not by choice, but because we didn't have anything to eat. You know, middle of winter, there's difficult to gather, and so you're really relying on the
Yeah,
wildebeest
got a
to
drought
come to
and
come
there's
by.
no
Yeah,
crop this year, maybe. Yeah. So
absolutely.
so one of the other things about the ketones, you mentioned about headaches. So is the headache attributable to your brain using the actual ketone itself?
You know, I don't know why ketones can cause a headache. I only know that I've done fasting diets and I can feel the ketones. You can almost, yeah, it's a ketone headache.
Well,
I actually don't know the answer to that question, Claire. I'm
and
sorry.
one thing I've noticed is that well, people get a bit cranky when they're producing ketones, but also that and I hope nobody said this to you, but I've noticed that you can smell them. Like they do
Mm,
come out on people's breath, and
breath,
people have said
fruity.
they feel like they can feel them, like they feel like they need to clean their teeth. So are they also the sorts of symptoms that the people in your research studies are talking about?
Yeah, we didn't actually ask that question, so I don't have a data record on whether they could feel them. But we certainly, in not in the last trial we did, but a trial we did a few years ago, we got people to use. You can get ketone sticks from the chemist, and you
Yep,
can dip them in your urine, and you can test whether you have ketones coming up. And we did that but not everybody did. So some people, which we absolutely knew were fasting. Because of other indicators, when they dipped their stick, they still didn't really have ketones come up, but some people went really high really quickly. And so I think that's super interesting as
all
well, and
right. So a huge
understand
amount of individual
variability.
variability, which kind of again makes sense. Some people are maybe tap into their fatty acid stores, their fat stores, and start producing
Fasting.
ketones straight away. And some other people, they actually have bigger stores, maybe of the glycogen that's in the muscle that they, so they didn't produce ketones. Okay, well that's
And we use our
interesting.
liver glycogen first generally when we're fasting. So when those stores start to come down, we keep the muscle glycogen to still run away from the bear.
That
We
woolly
don't tend to
mammoth.
use that. Yeah, so but the liver also has that glycogen store, and when those levels drop down, then we start to turn
Okay,
into
so it's
ketones.
highly variable. You might notice a smell, or somebody at your house might notice a smell. You might notice that furry mouth or the headache, but that means you're producing ketones, and that means that you're like a responder to this fasting, I guess. So, are there any other things that people need to be aware of? They go, oh, this sounds like the sort of, dietary strategy I might, are you more likely to get gallstones or, gout or kidney stones or anything like that?
We haven't seen that in our trials, whether they've been large enough to detect numbers and things like that. So that's not easy to say. Most of the trials that have been run are like 100 people or 200 people,
That's a
and
lot.
yeah, but they haven't detected, I guess, those any difference in
Okay.
incidence between
Well,
them.
Leonie, I think that's really reassuring, and that's, if anyone's living in Adelaide and they want to volunteer for any of your research studies, that shows you that the support and the safety measures you've got in place are working really well. But I know that anecdotally, that's what I've read in some of the research studies, or in unsupervised use of these approaches where people might not be following your specific study protocol. They're doing a DIY. I'm going to have a
Yeah.
crack at this. So they might need to be aware that there may be other things outside of a research study that may happen. Okay, so do do these fasting approaches then. So we now know that it might be like the time restricted is the big category, or this alternate day where you're going for 25% or intermittently, periodically, 2 or 3 days a week. Does that actually affect your metabolic rate? So, does it affect your metabolic rate or change the way your body is reacting to the food that it's being given?
So Uh, yes, similar to a calorie restriction diet. So if you're losing weight, your metabolic rate drops. So
Right.
that's the same with fasting diets. So you'll get this drop in metabolic rate. It's a compensatory response. As soon as you're eating less food, your body goes, "Oh, I'm going to put out less energy." So it's a compensatory response that occurs to all weight loss diets, and that's what we see in a fasting diet as well.
Yeah,
So
and
they are.
basically, I think we understand that it's basically your body going, oh no, I want you to be around to when the drought's over or the famine's over. So that kind of makes sense. But are there any other metabolic or endocrine processes? Because you said that sometimes these types of dietary processes are used for metabolic health. So can you tell me what does that mean, metabolic health, and who would those people be who need their metabolic health improved? Yeah, what does that mean?
So yeah, we see that fasting diets can reduce your diabetes risk markers, so improve or reduce glucose levels and improve glucose metabolism, so how your body
Mm.
responds to the glucose that it does eat. So improves your insulin sensitivity, your ability to, I guess, turn the glucose that's floating into your blood into the place where it needs to be, into your muscles, or getting it out of the bloodstream.
So it might
Um,
be worth just mentioning then, Leonie, just in case anybody goes, oh, I was told I got pre-diabetes, or, my relatives or have got diabetes. But some insulin's the hormone from the pancreas that zooms around in the blood and goes, woohoo, you've just been eating and turned all of that food into glucose, and I'm going to take that off to your muscles and your liver so that it's there. And I'm going to turn it into that glycogen so it's there for your rainy day or when you need it later on. But for some people, that insulin's just not working very well, or their body won't react. So they're making more and more insulin and glucose going up and up. So it's people in these specific situation, either type 2 or diabetes, where these fasting approaches have actually improved that impairment in their glucose and insulin regulation.
Correct. So weight loss diets do that. So we know that weight loss calorie restriction diets reduce diabetes risk, and improve that insulin's ability to work on the
Yeah.
muscles and the liver. But also, we showed in one study that fasting did it a little better than calorie restriction. So
Mm.
people who did a glucose tolerance test, which is a test that you do for diabetes. You drink a horrible drink, which tastes very, very sweet, and then we look at your sugar levels and how your body responds to that sugar that we give you, and how quickly it can put the sugar into the muscles and the liver. And we showed that fasting diets did that a little better than calorie restriction diets, but other studies have shown they're just as good. So
So there
our study showing it
may,
was better.
depending on you, because you've already said before about that huge variability in people's response, but for some people, this may be a better approach for them to improve their metabolic health, or it
Yep.
may not. And they would need to, well, either be in one of your research studies or maybe talk to their GP about managing that. But I do like that you said that you did the glucose tolerance test, and for some people, it really does improve their handling of both glucose and how their insulin works. Quite
And we
amazing.
also see improvements in cardiovascular risk, so reduced blood pressure. We see, I guess, reduced cholesterol levels, and reduced blood fats with the fasting diets, just like we see with the calorie restriction diets.
Healthy eating shouldn't be a luxury. Our No Money, No Time program supports Australians to access and prepare healthy, tasty food without the barriers of cost, time, or misinformation. No Money, No Time helps ordinary Australians, especially young adults and families, make good nutrition accessible, affordable, and achievable. We turn nutrition confusion into nutrition confidence. Make a donation to No Money, No Time today and help us continue helping others. Your donation will support access to free nutrition tools that change lives. Every dollar you donate empowers someone to take control of their nutrition-related health and well-being. Your donation helps us keep nutrition advice free, easy to use, while being backed by nutrition science. You can find the link to our donations page in the show notes or on the No Money, No Time website. We're a not-for-profit project. That means your donation is tax deductible. If you're not in a position to make a donation, you can still help us by coming to the website and sharing and liking all of the things you find on No Money, No Time. Help us help others to save money and time while boosting their nutrition-related health and well-being. Thank you.
Right. Okay. Well, what about appetite? So, do the fasting diets do anything particular to appetite hormones? You already told us that, well, you produce the ketones and then you're not hungry. But what about some of those other hormones that, drive you to eat? Does the fasting approach make you more hungry or the same hungry or less hungry or?
We both asked them how they were feeling and measured some of those
Yeah.
appetite hormones. When we measure them, because most of the time that we measure them following the eating day. So we get them to, so they've done the same amount of fasting. If they've done a calorie restriction diet, so it's measured after an eating day, not after a fasting day. And
Yeah.
when we look at that, they're exactly the same. So there's no change in the appetite hormones. But we also took a look at them after the fasting day, and we do see the elevation. So if you look at your appetite hormones after you've been fasting for 20 hours, then they're elevated as you would kind of expect them
Yeah.
to be. So I think that because we're swapping between eating and really not eating on one day to the next, we see this swing back and forth. And when you're doing calorie restriction, you're kind of a little bit elevated every day.
All
So if we
right.
average it out, it kind of looks the same. But
Yeah, yeah. So it really is again going to be that variable response. So you just made a good point that I realized I hadn't picked up on before. So the important thing is that when people are on a fasting day and just having the 25%, on the other day, do,
100% be full
yeah, just
level.
whatever you feel like. You don't have to have any restriction, but do people just then go, woohoo, I'm not on a fasting day and go nuts on those days? Or what do you observe happens to people on the non-fasting days?
Yeah, I didn't realize I hadn't explained that properly. So we tend to tell them to eat to their old regular diet. So
Yeah,
try and don't
the
overeat, don't
usual.
eat double. Yeah, don't eat 2 breakfasts, 2 lunch, 2 dinners to make
Yeah,
up for that. We have done a study once where we tried to do that, but that's another story. Yeah, so just trying to eat to energy balance so that overall you are in an energy restriction because you're 25% one day and 100% eating the next day. So you're switching back and forth between no dieting to an intermittent kind of pattern like this.
yeah, yeah.
Um,
But people don't necessarily then they're not going, oh, I'm on a diet the other day. So that's actually quite interesting. So how effective are these approaches then, given that, 2 to 3 days a week you're on 25% of your usual dietary intake. The other days you eat to your appetite, don't especially go low, don't especially go double. What's the difference in terms of, the results from these
yes.
dietary approaches?
So if you do 3 days a week, it's about a 30% caloric restriction. So you'll see 3 fasting days per week. So you'll see around about 7 to 10 kilograms in 6 months of weight loss.
Right?
If you do 2 days a week, it's only about a 20% restriction. So you're going to see less weight loss over
Yeah,
time.
but they
So
work. That's what
it's
you're
about
saying.
that. Yeah. Yeah.
And that's and is the comparison compared to, what did you compare that to?
So we compared it to a 30% calorie restriction. So we dropped everyone down to eating 30% less than they normally
Yeah,
would every
yeah,
day, or they did the 3 fasting days,
yeah.
25%. So that matches the
So,
same
and
same
was
amount of
it,
calorie.
okay. Oh, and so but they both work. Is that what you're saying?
Yeah,
Both
they both
strategies
worked.
work.
Both
Yeah,
worked. Both
yeah.
worked. We got 7.5% weight loss
And
in
that,
both groups.
and I think it's worth saying, Leonie, that, before when we were talking about pre-diabetes, that sort of target, that outcome is enough to drop your risk of developing type 2 diabetes if you've got pre-diabetes by about a half. So that's quite amazing. But the other thing that's just jumping out to me and you saying that is is it horses for courses? If you go, I love just doing 2 or 3 days a week, or you go, no, I hated it. I liked it doing the just 30% less every day. Is that sort of what it came down to then?
Yeah, I think we don't understand that yet. So I think that's a really thing to be able to pick, right? So if you could pick who's going to
Mm.
do well on this type of diet or who's going to do well on this type of diet before you start, then that's really important. But I don't think scientists we understand how to do that straight away, and it's like a process of trial and error to see what works for you.
But have you ever said to people, what one do you want? And and
I
shown
haven't.
any different in that? I think that would be
No,
interesting, wouldn't it?
it would be, but that's yeah, that when we're doing, we have to randomize control trials,
That
and we don't
darn
get any cho
scientific
choice.
quality.
I know, so yeah, that would be a very interesting study to do.
Yeah.
Absolutely.
Yeah, but I think the bottom line that this is really reassuring, so that if you're selecting, if you have the same level of energy restriction or calorie restriction, the way you described it, whether it's 20 or 30% achieved by intermittent fasting or everyday smaller reduction in energy intake, they will both work. It depends on which group you got randomized to into your study, and in real life, which approach you try.
Yes,
Okay.
I'd agree with that.
Okay, now
um,
my next question
yep.
is, because like I think about like, could I do this? And I think, oh, you take away all my, you know, 75%. I think I'm going to be pretty cranky and no one's going to want to be friends with me. So have you noticed any difference in the everyday small energy reduction versus intermittent fasting? Is there any differences in how people feel about being on the two different approaches?
So anecdotally, I think that we definitely get some people who say, I feel grumpy and I don't want to talk. I had a boss who did this once, and we wouldn't speak to him on fasting days.
Oh, what, you
When,
avoided him like the
yeah,
plague.
it was
Did he
terrible.
have a sign on his door that said, "It is day two," and
Yeah.
everybody went, "Head for the hills"?
Yeah, yeah. But if we look at scientific evidence
Yeah,
and look at, so people have done questionnaires where they're well-being questionnaires or their depression questionnaires, we tend to see, and there's not a lot of evidence actually out there comparing or looking at fasting diets and health and mental health and well-being, but it does reduce depression a little bit. There's some evidence for that. We didn't see, this was a systematic review that we did, but there was no difference in anxiety or mood, but they had a reduction in depression. So we're not seeing negative outcomes from fasting diets, at least by the questionnaires that we have available.
yeah.
Um, but maybe a little bit better for reducing. It's effective for reducing depression a little
So
bit.
again, I think that's really telling me is that if this is an approach that sounds like it might appeal to you, just basically shrinking your energy restriction for the whole week into 2 or 3 days per week, then would a good strategy be to maybe go and get a health checkup and talk about this with your GP, because like you said, it's important understanding about whether or not you're at risk of diabetes. You mentioned the drop in blood pressure. It sounds to me like it might be good to have those things checked before you launch yourself into a 3-4 or a 2-5.
Yeah, no, I think that's a great idea. And even just to get a baseline period of your health to go, okay, is this going to make any difference for me, to know to record somewhere what your weight is and what your health markers are, and to have a look for you whether it's doing what you want it to do. I think that it's probably, I don't know whether to raise now, but if you're pregnant, I don't think I'd undertake a fasting diet,
No,
for
the answer's
example.
no. No,
No,
no, no, no. And
no,
if you got
thank you.
morning sickness, you might already be on a unfortunate, bit of an energy restriction because you just can't look at food or smell or touch or taste it. So no, it is not
No,
a
thank
good
you.
idea
That's what I
for.
was going to say. And then also, if you take a anti-hypoglycemic medication, you really need to talk to your doctor. So if you're taking a diabetes medication that causes your blood sugars to drop, and then you're fasting, you may
Oh
need to
yeah.
change your medication before you undertake a study like this.
Yeah, that's a really, really good point. It's really important for anybody on any range of medications. I would think even maybe antihypertensive, so medication for high blood pressure,
Yep.
just in case you need some of those medications adjusted or at least monitored by your
Yep.
GP.
Because your blood pressure is going to come down with the diets anyway.
And one of the other key things on that, Leonie, is that I was chatting to someone recently and they weren't aware that adults are supposed to kind of know about their health. And I was telling them, they're like, there is actually a special checkup for your heart called a heart health check. And that it's a really good idea just to know what your blood pressure is and what your cholesterol is, and for your GP to be able to give you a once over once you're an adult. And so there's just a big shout out to doing that. Okay,
Absolutely.
so is there anyone else who should not? So we've said people on medications that lower their blood glucose, maybe for their blood pressure as well. Pregnant women, definitely an absolute no for fasting diets. Any other groups for whom this is not not necessarily, like, are there any other medical conditions where you would actually exclude them from one of your research trials?
So we do exclude people who have a history of an eating disorder,
Yeah.
and or if they score high on an eating disorder, just
So it
something
hasn't
weird.
been diagnosed, but like they are actually at risk based on those questionnaires you use.
Yeah, so we
Yeah,
exclude, but I again, and it's not my area of expertise, but I think again somebody like that should be seeking help from
definitely.
psychology professionals.
Yeah, and definitely go and see their GP. And I always like to mention when it comes to disordered eating broadly, there's a wonderful website called the Butterfly Foundation, and it has amazing resources that can help both individuals, teachers, and parents if they're worried about um, any of the categories of eating disorders. So there definitely are some people who should not go on a fasting diet. But okay, so you've done a lot of research in this area. So what would be the key takeaways or the key recommendations for people listening what would you say are the key, like, public recommendations based on all of the fasting research that's out there?
So I think it depends on their goal as well. So when we're talking about the time restricted eating, I think that the time restricted eating diets are probably more sustainable for a longer period of time. So you've got a more mild intervention where you're eating 8 hours a day, say, and you're fasting 16 hours a day. You're doing that every day, but it's less restrictive as a diet. You only tend to lose 2 or 3% of your body weight, and you only have small changes or improvements in your health when you're doing the time restricted eating diet. But we've kind of shown that people can do it for 12 months fairly easily, and they still like doing it after 12 months.
Yeah, because that's
Whereas
kind of a
we've
set and forget, isn't it? Try and have dinner earlier,
yeah,
close the kitchen, have your breakfast a
yeah.
little bit later. I think that's one thing I've noticed, Leonie, like as I've gotten older, is gee, I'm getting like my parents. I really like having an early dinner, and and if I'm busy, if I'm going to rush off because I want to do something on the way to work, like go for a swim or something, I put my lunch in my breakfast in a lunchbox, and I have it when I get to work. And just you talking there, I think, hmm, I'm thinking on some of those days I'm doing a time restricted diet based on just my normal lifestyle. So I think that that might be for people who are going, I've got to work out, I'm getting older, my weight's going up, I don't know what's going. I agree. I think that might be an easy thing for people to look at the timing of their
Mhm.
meals and whether this is. Do you find this? So with that time restricted eating, I think a key thing for people is that if you go, oh, that's right, the kitchen closes at 7 p.m., it actually stops people mindlessly eating in front of the television or in front of their computer or whatever they're
Uh,
doing at night.
And I think it's often a time where we make bad food choices as well. So we don't tend to reach for an apple at 8 p.m. It tends to be the Kit Kat or the ice cream or the
You're
wine or.
You're true, yeah, yeah, or the carton of beer. You are
Yeah.
absolutely right, and I've certainly heard people say, like, the movie's over or whatever, and they go, "Who ate the potato chips?" And they're going, "Oops, actually, they
Maybe.
hadn't realised they're doing." And yeah, and I always say to people about that probably goes along with the time restricted eating. Like if you go, we don't eat on the couch because I say, people don't eat carrots when they're sitting on the couch usually. So I agree. I think that's probably a nice thing that marries well with the time restricted, even if it's at 14 hours rather than 16 hours. Okay, so for people, these approaches can work. It's going to be a bit variable whether it works for you. If it doesn't work for you, and you really are trying to use 2025 to, improve your weight-related health, there are other strategies. We both agreed, great place to start. Go and talk to your GP, and then from the behavioural thing, I think we both just agreed no eating and drinking on the lounge, but
Yep.
maybe think about the timing and whether just starting with an overnight time restriction on when you're eating it's not even really a diet. It's just helping you avoid that mindless eating.
Yeah, I think it's a tool to help avoid mindless eating. That mindless eating, and yeah, as I said, it's a easier sustainable strategy. So the fasting diets that we do, people can do great on them for 6 months, but it's really hard to maintain really long term. Just like an energy
Yeah,
restricted diet is really hard to maintain long term. But if you have those you want to drop those kilos, then the intermittent fasting diets are going to bigger bang for buck in
yeah,
terms of improving health and changing
yeah,
your body weight.
yeah. And Leonie, I did talk to someone who's a metabolism researcher, and we both kind of agreed that there's lesser evidence on the maintenance of lost weight, but those same evolutionary processes are trying to get you back to what your previous weight was. So that around that 6 month period is a really another key time to go and talk to your GP about whether other support strategies need to be put in place in order to improve your weight-related health and well-being at that time point. So, are there any other key recommendations for the public before we jump on and talk about, what you like to eat and what your recipe that you're going to give us for No Money, No Time?
Uh, no, I can't think of anything else. I think that's it, Claire.
Well, I
Thank
think
you.
they're great. They're great takeouts. So, what are the sorts of foods that you like to eat? And then, what is the recipe that everyone else can copy at home? Because we're going to put it on and call it after you on our No Money, No Time recipe site.
Yeah, so you asked me first of all what would be my favorite food
Yeah, what's
to
your
eat, and
favorite food?
I said fish tacos, which is my absolute favorite thing to eat, but it's not a no money no time recipe because we make our tacos ourselves and it takes absolutely hours. But I do it every Sunday, and I
Oh
love eating like
wow.
a fish
Oh wow. So
taco.
that's a ritual in your family.
It is a ritual in our family, and it's delicious, but it takes ages. But the no money, no time recipe that I put forward was sang choy bao,
Yep.
which is that meat wrapped in lettuce cups. I have three children.
Yes.
Their ages are 16, 12, and 7.
Yep.
And they all love this recipe. So,
Yep.
and I can stuff veggies in it. So you cut it really fine. Veggies. I put in like mushrooms, onion, uh, water chestnuts, carrot,
Oh yum.
and then you kind of, with some mint sauce and some flavorings and eat them in lettuce cups. So they
That
love that
sounds
meal, and
yum.
it's really fast to make as well.
And it sounds to me like maybe there might be a bit less washing up if you get them to eat with their hands.
That's it. So you've got one pot and some
Okay.
plates. So
Well,
yeah.
we're going to put the Leonie Heilbronn Sanchoy Bao on there, but I've got to tell you, Leonie, we actually do. Someone else, their favourite recipe was fish tacos. So we actually have got. It's not your recipe, but a
No,
different version on No Money
if
No
you're not
Time as
making the
well.
taco, it's probably not too
They
too bad.
she doesn't make the
Yeah,
tacos.
yeah.
Well, thank you so much for your time today. That's been really fascinating walk through the research around the fasting strategies. I think that gives people who are interested in this approach lots of information. So thanks for being our guest on no on I was going to say No Money No Time, but on Nutrition Science Bites, and it's located on the No Money No Time website. So thank you.
No problems. Thanks for having me, Claire.